Thank you all for being here. We have a lot to cover today, and we have a lot of individuals here that are going to be talking about the countywide response to COVID-19. Before we get to that, I'm going to do quick introductions. Leslie Hervey is at the far right of the dais. Jackie Paniotto, the clerk to the board, is next to her. County Commissioner Victoria Parks is to my immediate right. To my immediate left is the vice chair of the board, Stephanie Sumro Dumas. Next to her is the county administrator, Jeff Aludo, and legal counsel Michael Friedman is at the end of the dais to my left. We start our meetings with silent prayer and the Pledge of Allegiance, so please stand if you can. Amen. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Going to move that we approve of the minutes of the previous session.
Second.
Yes.
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 Thank you. All right, we're going to get to then our first order of business, which is countywide response to COVID-19. We have a number of individuals here from the county. This situation is so fluid. It's changing every day. It's changing every hour. And so we're trying to do our best to keep people up to date on what are the impacts internally, but also, and really probably more importantly, are what are the impacts to the community as far as the elections that are coming up, as far as the court system, as far as, all the things that the county does. And so we will hear from those individuals who are the experts in all those fields. The sheriff is here as well, to talk about what we are doing to better position ourselves at the county to make sure we're being as safe as possible internally and externally. So the first thing that we're going to take up is a resolution that the board will pass related to a state of emergency in Hamilton County. We have been talking about this with emergency management and public health to make sure that the timing of this was appropriate, to make sure that we are on the right track. And upon the advice of both of them, we are taking this issue up today. A couple of things have changed, and I will let others explain or go into some detail here. But one of the main things that we learned yesterday is that we have community spread in the state of Ohio, and that was new as of yesterday. Remember that we had cases previous in our community, but they were all linked to someone who we knew had been exposed to COVID-19. That is no longer the case. We have an individual in Stark County who there's no apparent reason that he would have the infection, and so we are responding to this new information, and we think it is prudent at this moment in time to take this action. Before we do it, I do want to expand just a little bit on what it does. So the state of emergency, as we declare it, will allow us to accept federal funds to respond to the emergent nature of what's happening in our community and what may happen in our community. And it also allows us to speed up purchasing. So as we need to do things at the county and get materials and supplies, we will be able to do that more quickly. And obviously that is important as we go into an emergency or potential emergent situation. The third thing it does is raise awareness in the community. Again, we want to make sure that people understand that this is serious. This is a health threat in our community. I think we don't want to jump to the gun, but we do want to be prepared. And I know there's this balance between those two things. But again, and I'll let the other commissioners speak for themselves, but I believe this is a prudent response at the right time to make sure that this community is kept as safe as possible. And so, Greg, so the interim commissioner of health is with us. So, Greg, we do have a visual here to talk about how the action today is going to potentially help us reduce the exposure in this community, particularly for those at risk, by way of the state of emergency. So could you just expand a little bit on the chart we see behind us, and then we will move into the action of the board and the comments from the commissioners.
Perfect. If it's all right with you, I'll step up and draw a line on and then come back to the podium and explain. So what public health knows from pandemics is the sooner you take action, the sooner you can slow down the spike of illness. So the yellow portion of the chart there describes what happens if there is no public health or no intervention whatsoever when a pandemic is starting. And that's significant, and that is actually what experts believe is happening over in Italy, where we are seeing scarce resources and we are seeing the medical system being stretched beyond its capacity. The black line kind of represents, that I just drew, the black line represents the hospital system capacity. So with intervention, the blue bubble, or the blue portion of the diagram shows what would happen if public health takes some interventions, including some of the social distancing that we've been hearing about, the canceling of mass gatherings. When we are able to slow down the spread of disease and slow down the incidence of humans getting sick, we are able to keep the numbers within a more controllable level. So it's extremely important that we take the interventions now, including the state of emergency, to ensure that we are not going to see that spike. Everything we do today will prevent that spike from happening is our belief.
Thank you. I think that's really helpful. Before we take any action, I want to turn it over to the other commissioners for comment. So Commissioner Summer-Dumas.
Thank you, Madam President. You've said it all. I think our effort in taking this step and declaring a state of emergency is to emphasize the seriousness of this virus. A lot of people are not taking it serious, and we want to step up as the leaders of Hamilton County and indicate that this is extremely serious, it is fluid, and we need to jump on it, and we need to do the things that we can do to prohibit the spread of it. So you've said it all, and so we felt it necessary to take a stand and say that.
Thank you. Commissioner?
Thank you, Madam President. I agree. I think that pro-action is the best manner that we can work in order to stop this, or at least control it. It's important to take care of our community.
Thank you. All right, Administrator Aludo, anything further, or we're ready to move on the resolution?
No, nothing as it relates to the resolution. I think you framed it perfectly.
All right,
Thank you.
good. Thank you. All right. Then I am going to move that we approve of the Hamilton County Board of County Commissioners' declaration of state of emergency due to COVID-19.
Second.
Yes.
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 Thank you. So in addition to passing the state of emergency resolution, we have a number of individuals here who want to illuminate what we are doing on a countywide basis to tamp down the spread of the disease and try to carry on with regular business. As you all know, we have an election next week, and so Sherry Poland is here from the Board of Elections. You're the president of the Board of Elections.
Director.
The director, my apologies, I gave you a promotion. And so she is here to help us better understand the current state of affairs, and so please help us out there.
Thank you. Good afternoon. First of all, I wanted to touch upon something about the polling locations being moved. So on late Monday afternoon, the Secretary of State ordered all boards of elections in the state to move polling locations that are housed in residential senior citizen facilities. That affected 26 polling locations in Hamilton County. To put it in perspective, we have over 300. So most voters, their polling locations have not changed. Those voters whose polling locations are changed, we move them to nearby pre-existing polling locations. So essentially we'll be operating 2 polling locations out of the same facility. One will be on one side of the gym, for example, and the other on the other side of the gym. We have put together notices to all of those voters. They should start receiving those in the mail tomorrow. We also have our website updated, so we encourage voters to go onto our website, votehamiltoncountyohio.gov, to find their polling location, or they can always call the Board of Elections for that information. We also are working with the senior citizen centers to ensure the residents of those facilities are able to vote early, and we've already begun that process. And actually, votes are being cast at this moment by those residents in those facilities, so they will have the opportunity to vote. As far as what we're doing at the polling locations on Election Day, we are sending hand sanitizer and disinfecting wipes to all the polling locations, along with a flyer from the CDC about best practices on how to prevent illness. So that'll be available on all the polling locations, and the poll workers are being instructed to take breaks frequently, to wash their hands, and to disinfect the polling location frequently throughout the day. For those who wish to vote early, if they do not want to go to the polling location, our office is open until from 8 a.m. to 7 p.m. tonight and Friday for early voting. We have weekend hours, Saturday 8 a.m. to 4 p.m., Sunday 1 p.m. to 5 p.m., and then again on Monday 8 a.m. to 2 p.m., and that's when early voting ends. Those who wish to vote by mail, the deadline is fast approaching. They have to submit an application to the Board of Elections. That application has to be in our hands by noon on Saturday. We also have a drop box at the Board of Elections. It's a drive-up drop box. Voters do not even have to get out of their cars if they wish to turn in their application that way, or if they wish to turn in their ballot by mail. If they're going to mail the ballot, it needs to be postmarked by Monday, March 16th in order to be counted, or dropped off at the Board of Elections by 7:30 p.m. election night. I also want to point out for those that are working the polls and those that want to vote on Election Day at the polls, that polling locations are not considered mass crowd gatherings, okay? When you go to your polling place, they're in your community. So you're going to vote with people who live in your geographic community. These are the same people you're going to the grocery store with or the pharmacy. So it's not like NBA sporting event where you're bringing in people from all different communities that are in the same facility for hours at a time. Usually voters can move pretty quickly in and out of the polling place. Lastly, we have a need for poll workers. Most of our vast majority of our poll workers are over the age of 60, and they have served our community well, and now it's time for younger, healthier adults to take on that responsibility. Our goal is to recruit 2,300 poll workers. We are somewhere around 2,000 right now. It's a fluid number. We've had some poll workers in the last couple of days contact us and decided not to work the election because they're elderly or have a pre-existing health condition. So that's why we are coming to the county and asking for your help in recruiting county employees to work Election Day. We have set up additional training classes for those employees on Sunday afternoon and Monday morning and Monday afternoon at the Board of Elections facility. They do have to be registered voters in Hamilton County to sign up. We ask that they have their own transportation of vehicle because we want to send them to wherever polling locations that are experiencing a shortage on Election Day. We are in constant communication with the Secretary of State's office and following his direction as we go through this process, and I'd be happy to answer any questions.
Can I just ask you to illuminate a little bit on the training and how long the training is on Sunday and Monday?
Sure. It's a 4-hour training class. So Sunday we are offering that class from 1 p.m. to 5 p.m. Again, Monday morning, 8:30 a.m. Until 12:30 p.m., and then 1 p.m. to 5 p.m.
And is there compensation for
Yes.
those that choose to do that?
Yes, there is. Poll workers make anywhere from between $181 to $218, and that's a total lump sum. That includes their 4-hour training. They then go to the polling place Monday night and set up the polling place, make sure it's ready to go election morning, and then work Election Day. On Election Day, they need to arrive at 5:30 a.m. because polls open at 6:30 a.m. Polls close 6:30 p.m. Takes about an hour to wrap things up after that.
Great, thank you.
Madam President?
Yes.
If I could just expound very briefly, just so the board is aware, the Board of County Commissioners does have a policy. I believe one was passed in 2008. It was re-upped in 2016. That is incorporated into our personnel policy manual regarding paid poll worker leave. So employees for the county can volunteer to serve as precinct election officials without having to take any accrued time and without losing compensation. So the board has been very accommodating to employees. Regarding this, I sent out a communication just earlier today to all department heads asking them to get this information again to their employees and encouraging employees, anyone who is a qualified employee, full-time or part-time qualified employee, to contact the Board of Elections to volunteer for this opportunity.
Perfect.
We thank you for that.
How many are you looking for again?
Well, it's a very fluid number. Right now, we're looking at about 300.
Okay. All right, great. Are there questions or comments?
I have no questions. Thank you.
Okay, well, thank you so much, and we'll do everything we can to push out the information, and we hope that our partners in the media will do the same.
Thank you.
So that things go off without a hitch on Election Day. Thank you. All right, well, the sheriff is in the house. Jim Neal, please come forward. I know there are some precautionary measures being taken over at the jail. Good afternoon.
Good afternoon.
Good afternoon.
Let me raise this a little bit. Yesterday, I put out a public service announcement that we're going to cancel non-essential inmate visitation. And it is, but we highly recommend and encourage the essential visitations that involve law enforcement, attorneys, chaplains. They have an option of non-contact visits because we can utilize the mezzanine for those visits. So they have that option. I'm hoping they exercise and choose that option versus contact visit. But the non-essential visits of family and friends has been put on, they've been canceled and put on hold for right now. Operationally, as you know, we contract with a NAVCare for our medical and mental health service provider. But also in our other operations, I just want you to know that we're putting together a plan in case our own employees are stricken by the virus, so that we can maintain a level of service to the people in our community. So it's, as you said, it's ongoing, it's fluid, and so we're prepared, and we're preparing.
Thank you for the update. Are there any comments or questions for the sheriff?
No questions.
No questions.
Okay, thank you. Sheriff Neal?
Madam President,
Yes.
just very briefly, just to tack on to the sheriff, and I want to thank the sheriff. We had a very productive meeting yesterday with his staff and staff from juvenile court related to the juvenile detention facility, et cetera. But the sheriff's actions on the seizing of visitation also echoes and comes as a response to the state's action and the governor's action suspending visitation at all adult detention facilities and juvenile detention facilities. So I think this was partly an effort to stay in lockstep with the state on this as well.
Thank you.
Madam President, Sheriff, on the juvenile detention, is there still some discussion on how that's going to be handled?
Juvenile detention?
Visits,
Yeah, that's not under my
I just wondered if you had heard anything.
So we are working with juvenile court on that, and I know for that, at least as of as an initial step on that, juvenile court has revised some of their their screening protocols to ensure that that as juveniles enter the facility, there's additional screening regarding through Children's Hospital to ensure whether there's a pre-existing illness, et cetera. There are some additional issues with the juvenile detention facility. Number one, there is an issue regarding parent-child interactions that happen through visitation. It's also just a different type of facility as well, whereas, you know, the Justice Center, we have hundreds and hundreds and hundreds of people. It's a much lower populated facility at the juvenile detention facility, and I think we want to take a prudent, sensible approach and not take just a cookie-cutter approach to all of our operations.
I would like to add one other item. As you know, we have a chaplain in the county jail, and we have a chaplain service that is next to none. And they decided, the worship services on Sunday, they decided to cancel until further notice. But the good news is we have video from a number of congregations that were provided in parishes and temples that we can play, you know, through our TV, our circuit. We can plug it in, and we have that video available for the offenders.
Okay.
So,
Great, thank you. Thank you, appreciate that. Aftab Pureval is here, Clerk of Courts. He's going to provide an update. Good afternoon.
Good afternoon. Thank you, Madam President. To the Commission, thank you for giving us this time. The Clerk's Office has already taken steps to help mitigate the spread, and I'm grateful for the opportunity to provide an update. What I want to say to the public is simply this. My administration has expanded online services to date, and we highly, highly recommend that the public use those online services and avoid coming to the courthouse. avoid coming to the courthouse unless you're legally required to do so would be a great help to the community and to my staff. And just as a refresher, there are several services that we provide online. The community can pay court costs, pay all moving violations. They can electronically file court documents in all of our courts except for municipal criminal traffic. They can request court documents online, and they can look up their case online as well. So please do leverage those services. For any questions about these services, the public can call us at 513-946-5656 or email us at info@cms.hamilton-co.org. My office has also put together contingency plans for our staff and for the services that we provide. And I know that Director Pat Dressing is here as well to speak on behalf of the court, and we've been closely coordinating with the court because, as you know, all of these services are interrelated in that courthouse. Our contingency plans range from worst case scenario to best case scenario, but we are prepared on that front. And also on a final note, we've provided our staff with access to hand sanitizer. We've encouraged them to wipe down high-touch areas in the courthouse, and we've educated them on our comprehensive paid family leave program that we have. What we're concerned about is not only our staff falling ill, but if CPS closes and our staff who are parents are forced to find childcare, and if they can't, or forced to not come into work, that's also a big concern of ours. But we're preparing for all of those contingencies.
Great, thank you.
Any questions?
Comments or questions?
No questions, thank you.
No questions.
All right, thank you for being here. Really
Thank you.
Appreciate it. Thanks for the update. Yeah, Pat Dressing is next. He's from the courts. Thank you for being here.
Thank you for the invitation. I appreciate the opportunity to give you guys an update with regard to the situation at the courts. What I can indicate to you is that we obviously offer a core government service here that also has attached with it the responsibilities of assuring that individuals are given their constitutional rights. So I don't know if we ever get to the point of, to what level we get, but we're preparing for everything at this point in time. I will indicate that the courts are closely monitoring the situation, including the updates on the internet, on Twitter, the media feeds and whatnot, that include Governor DeWine's office, Mayor Cranley's office. They've actually really been great, and I've been focusing in my discussions with people about that exact chart there when they indicate, well, this flu thing, this coronavirus thing is not that big of a deal. It really is, and that chart to me really brings it home, and it's really what we're trying to focus on too. And the efforts that we've taken to try to flatten that curve out are to encourage our employees and visitors at the courthouse to mitigate any risks, as most people have indicated here with the hand sanitizers. We have increased cleaning at high traffic, high touch areas. You'll see, as FTAB indicated, that there are Purell stations at different points of the courthouse. I think at this point now, we have them at each one of the elevator banks. And my understanding is that after discussions with Facilities Department, we're going to put even more up about halfway into each hallway. And as I was going around talking to judges today and preparing for this particular meeting and other things, I probably use those hand sanitizers 3 or 4 different times just to mitigate that potential risk. One of the other things that we're doing with regard to mitigation of risk is to cancel or delay any non-essential public gathering that's occurring in the courthouse. Unfortunately, we had a competition, a moot court competition that was going to occur over the course of the weekend. It was a regional event, and our concern was a bunch of individuals from different areas are coming to congregate and potentially bringing contaminants into the courthouse. Again, in an effort to mitigate that risk, we have gone ahead and indicated to those individuals that we're canceling that event. We also have a fair amount of schools that like to come through, programs related to visiting the courts and the Justice Center and whatnot. At this point in time, we put those on hold as well. And one of the other main things that we are also doing Our biggest gathering of individuals in the courthouse is the jury commissioner's office. Anywhere between 150 and 200 individuals come each Monday to hear a jury orientation, and then typically they fill out a questionnaire, and then they spend time in that jury commission office until a panel of jurors is needed to go to one of the courtrooms. There are 30 courtrooms, 16 common pleas judges and 14 municipal courts, along with typically 1 to 3 visiting judges. So there are quite a few number of individuals that have to sit around and wait until those matters are ready to be heard. We are preparing to have jurors come in next Monday, and I believe we're going to have a release to the media that will kind of outline that. They will be provided information as they walk into our offices and be told to then go home. We will obviously have their contact information, and they will be told at a later time in the day to contact a certain telephone number so that they can see if their services would be needed the following day. What that can accomplish is, instead of having 150 to 200 people sitting around in jury commissioner space, we can more accurately target the need of jurors and call in only those that we will need. So we hope that that will, again, mitigate that risk. We'll see how that continues. And again, we are constantly monitoring the situation. We're talking with our partners. In fact, as we speak, I believe some of my staff are meeting with clerk's office, Perel's office as well. We have had contact with the Sheriff's Department. In fact, I just had a meeting with them with regard to the inmate population, and obviously individuals that are held during the course of a trial have come over to the courthouse. So we're working with the Sheriff's Department to assure that we can mitigate any risk from inmates coming from the Justice Center over to the holding cell and eventually to a courtroom. So as I said before, we're a core government function. We will take all necessary steps to protect the public and the workers. So
Thank you. Appreciate the update. Any comments or questions?
Thank you. Thank you. No comments.
Okay,
you
thank
very
you.
much.
Thank you for the update. All right. Greg Kesterman, the interim health commissioner. We have been getting updates periodically from Greg and from Nick Crosley from the Emergency Management Agency. And so please give us the update as of today. We're going to continue to have you in just to provide us with relevant information as we move through this.
Sure. Thank you, Commissioner. So every day at 2 p.m., the Ohio Department of Health updates their numbers. And as you've already described, Ohio now has a total of 4 cases that are positive for COVID-19. One of those cases is community spread, meaning they acquired it from an unknown source within the community. Interestingly enough, that case in Stark County was infected on the 25th. So a couple weeks ago. And the importance of that is we know that it is in the community. And that brings even more urgency for all of these measures that the governor, the director of health, and that we just heard here from all of our county agencies. I would say probably at this moment, the cancellation of mass gatherings is certainly a big deal for people. And it's important that we do that right away so that we can reduce the number of people coming in contact, potentially with sick individuals. We know it's flu season, but we're kind of moving beyond flu. We're talking COVID-19 and the importance of reducing impacts to others and letting people get sick. Individuals who get COVID-19, it depends on their age, but in certain age groups, it is certainly more serious. The illness is more serious, and the likelihood of death, particularly for those over 80 or even in the range of 60 to 80, is much more significant. In the case of somebody who is between 40 and 60, which is fairly young by my standards.
Ditto. We all fall in the other category, I think.
The incidence for flu for somebody between the ages of 40 and 60 is 0.1%, which is actually the average for flu across the age range. That means 1 out of 1,000 people are highly likely to pass away as a result of the flu. For COVID-19, that same age range is 0.4%. which means 4 out of 1,000, or another way to looking at that is 1 out of 250 people could have significant complications from COVID-19 and could pass away. The importance to taking action now is significant. So we are working closely with our partners at the Ohio Department of Health and obviously follow all the guidance from the governor. And today we sent out communication to all of our school districts, letting them know of the new school guidance, which talks a lot about canceling extracurricular activities that do not involve students only. So for example, if you are going to go to an extracurricular activity and it's art club and it involves students that have been together all day and a teacher, I think that activity is okay to continue as those students have already been together. But if you're going to have an art show after school or a school carnival, now is the time to start making plans to cancel that. Those events are bringing people from the public in together into our schools and put our children and put our community at greater risk. The time is now to start slowing those activities down. I would say that is probably the biggest change that I have in the last 24 hours. We already heard yesterday that we were looking to cancel spectators at activities. This is at the professional level, the collegiate level, and kindergarten through 12th grade. So the governor has made it clear at this moment in time, we know that there has to be parental guardians for those younger age groups, so it's okay for parents to come, but we're no longer at high school gyms inviting the entire school in and parents in and spectators in. We're starting to request to limit those numbers. So now is the time to take those steps to reduce mass gatherings and to reduce the incidence of the spread of COVID-19. Happy to answer any questions.
Yeah, and I do want to also say that there is a call. We have been trying to keep the jurisdictions up to date on this information and make sure that the information that we hear, this is a limited space, and we're pushing it out to all 49 jurisdictions, to the electeds, to the administrators, to the fire chiefs, to the police chiefs, to make sure that they also have up-to-date information as we move through this. And so those calls are happening on Friday at noon. Is that
That's correct.
Yeah.
Yep.
Okay. And so I just want to make sure that the community is aware of that, and and I know you're communicating with those outlying jurisdictions. Are there questions or comments for Greg?
Thank you, Madam President. Thank you for your presentation and
Absolutely.
your update. We've been notified of the confirmed cases, and so you may not be able to answer this, I'm not sure, but the cases that are not confirmed that you're waiting to see, are there any cases such as that in Hamilton County?
What I can tell you is all cases, once they're confirmed, are handled at a county level because I think the need for information is significant at that moment in time. Mm-hmm. Those that are not confirmed are still being handled at the statewide level. So as of yesterday at 2 p.m., there are 24 cases statewide. I can also share that as public concern rises associated with COVID-19, our team are fielding dozens of calls all day long from individuals and doctors' offices to determine if testing is required for those individuals. And that is not limited to just Hamilton County Public Health. That is a statewide issue for all public health departments as we try to make sure the physicians and the medical community have the information they need to make an educated decision whether or not to pursue a test for COVID-19.
Okay. So specifically, as far as someone being in self-isolation, something like that has not been confirmed, do you have any evidence of that in Hamilton County?
So in Hamilton County, as I've shared during previous commission meetings, anytime somebody has been associated with a person under investigation, is a person under investigation, or has known travel history, those individuals are being tracked at a county level. The county health department then contacts those individuals, and we have done so. Hamilton County Public Health has had those contacts and still has those contacts countywide. So we are tracking those individuals once per day.
So how many are those?
I do not have that exact number, and we are not supposed to share that
That's
at
what I was
a
saying.
county
You may
level.
not be able to say
Correct.
that.
That's
people
correct.
Get excited.
But we do have those here and statewide. I would be surprised if there's any jurisdiction that this time that isn't monitoring one or two individuals to make sure that they're not symptomatic based on those criteria.
Thank you.
Thank you.
Thank you. No questions.
Thank you.
Okay. I just want to clarify something, just to make sure folks understand, because we just talked about the individuals that are under surveillance, but the The game changer was what happened, or what we learned out of Stark County yesterday, where we don't have that kind of history with an individual, and there's no known contact, there's no travel history, and yet someone has COVID-19. And I think that is something just to note, and the reason for kind of, the changed behavior is that things have just gotten more serious, because you don't have to have a travel history or have come into contact with someone that you know has COVID-19 in order to worry about not only your own personal health, but infecting others.
That's correct, Commissioner. And I think it's also really important to note, for better or for worse, 80% of individuals who become ill with COVID-19, the symptoms are actually rather mild. They might exhibit themselves as a common cold or potentially a mild flu. And many of us know people that have come to work with a cold. And so if that individual with COVID-19 is now coming to work and experiencing symptoms like the cold, but actually has COVID-19, they have the same risk of spreading the cold or COVID-19 to other coworkers. And right now, it's even more important that you're not taking it to work, that you're not taking it to gatherings, and that if you're going places, you're very aware of what you're doing. We don't want those individuals to eat out at this time. We want them to eat at home if you're sick. Even if you think you just have the cold, now is the time to take that extra precaution, because we don't want you to make people in the public sick.
So lastly then, if someone does suspect that, or they are ill, what is their best course of action?
Anyone who is sick at this time, we are asking them to stay home. If you feel the need, you certainly can contact your primary care physician. Even individuals, the 3 individuals that were first reported in Ohio, in Cuyahoga County, all 3 individuals are still at home, even though they have positive COVID-19. Those individuals are healthy, and the best spot for them is at home and not putting a burden on our healthcare system. So anytime someone is sick, we're asking you to stay home. If you need medical attention, we'd like you to contact your medical provider, your primary care physician, and have a dialogue with them and let them know what your symptoms are and what questions you have and what concerns you have as it might relate to COVID-19. And they will direct you to where you can get the appropriate testing.
Okay. And there's no concern that we don't have enough testing. We've got the capacity to test.
At this time, there's enough testing capacity in Hamilton County and Ohio.
Okay. And I do want to mention that there is, from my understanding, a press conference at 3 related to the medical response to this, and the hospital system will be responding to some of the same questions.
That's my understanding
Yes.
as well.
Madam President,
Yes.
will you kindly talk about the risk factors depending upon age?
Certainly. So the risk begins at age 60. So between 60 and 80, you are at higher risk, and the highest risk is for those over the age of 80. At that point in time, you're at significantly higher risk. We heard the governor take some significant measures within our nursing homes statewide. In fact, the governor is restricting visitors in nursing homes to 1 visitor per day per resident. In addition, in nursing homes where we're serving our most vulnerable individuals, there's screening that's happening to all visitors. That includes, I have staff that go to nursing homes to do restaurant inspections. Those same staff have been informed that they're not to go into the nursing home until they're screened by the nursing home folks. It's extremely important that public health and everyone sets the example as we go into these places to protect our elderly.
I see. I was interested to learn about the low risk of children.
Okay, thank you. So, ironically, we heard many years ago with H1N1, we had a significant risk to children. And so when public health was involved, our major response, we actually had a vaccine at that time. The individuals that received the vaccination were not first responders first, it was children first, because adults were not impacted in the same way. Opposite this time, the individuals that are impacted from COVID-19 are the elderly. Children are actually, for the most part, not showing any signs or symptoms or significantly less. In fact, the death rate for the flu, as I mentioned, is 0.1%. Children are even lower than that, which is good news for the kids, but it still means that a child could have symptoms and bring it home to grandma and grandpa's house and make them sick. So even more reason for those school interventions and those things that we're talking about preventing community spread.
Thank you.
Thank you.
Thank you. Thanks, Greg, for being
Absolutely.
here. Appreciate it. Nick Crosley with the Emergency Management Agency is next. Welcome back.
Thank you. Thank you for allowing me to speak today. Basically, I gave you a pretty robust update on Tuesday. What this changes for us at this point is we have, as of 20 minutes ago, partially activated our Emergency Operations Center. What that means is we are bringing in our health partners what we call Emergency Support Function 8, Emergency Management under Emergency Support Function 5, Resource Management, so we coordinate that with county assistance and our partner assistance. And then we are activating our Emergency Public Information Arm, which has already been active, but now we are more formalizing that under what we call our Joint Information Center. And so, as I stated yesterday, we're involved in coordination. So we're coordinating from the local to the county to the state level, and through the state to the federal government. There is some movement on a federal declaration. Not sure if that's going to happen or not, but I am watching that from a congressional level. We are also actively engaged in planning. So we have a joint emergency operations center that's working closely with the city of Cincinnati, reaching out to the other health departments, although Hamilton County Public Health handles a lot of that. And if you are signed up for our COVID alerts, we have already sent out information about your emergency declaration, both explaining the purpose and scope of the declaration, but also, once again, our primary message: prepare, don't panic. And I think that's clear. I think Greg's chart clearly shows that if we have an honest conversation about COVID-19 and how to mitigate the spread of COVID-19, that we can really limit the impact of COVID-19 in our community. And I think that the state and the leadership of our county and city health officials is really stellar right now. And we are helping to magnify that message. So we are currently communicating via Nextdoor. We are setting up a communication plan, so we'll be using all of our channels where we will be communicating. And the great thing about this event is that all of the information is out there almost as soon as it comes out. And so there's nothing, as I like to say on the local level, nothing top secret. So we immediately tell people, these are the cases we have, these are the cases we're investigating. And again, prepare. And that's our message. So we are working hard to coordinate county-level resources to help our local communities, as well as coordinate with the state. And then we are working hard with our media partners and others to educate the public and mitigate the impact on this on the community as a whole.
Great, thank you. Any questions or comments for Nick?
No questions.
No questions.
All right, thank you. Thank you for being here. And then lastly, the County Administrator, Jeff Aludo.
Thank you, Madam President. Nothing overly significant to report at this time. We're doing a lot from the county administration's perspective in terms of working with our operational departments to make sure that they're prepared, that they're exercising their continuity of operations plans. We're reviewing and revising sick plans and policies related to sick leave. We have done things like eliminating non-essential travel at this point under Board of County Commissioner departments. We've taken steps to enhance environmental cleaning in all of our county buildings. A lot of things that are internally focused at this point, and I just really want to thank. So while I could go into extensive depth on all of that, I think the message for a meeting like this is really to continue to push out those things that are outward-facing and public-facing. And to that extent, I really want to thank the work of all the department heads and all the elected officials who are really being forward-thinking and forward-leaning on this. And with that in mind, just one additional item, I think, is Administrator Dressing still here, or did he leave? Do you know?
He's still here.
He is still here. One question I had, Pat, was, and you may have mentioned it, I'm sorry, but I thought it was an important point if it was not mentioned, is as it relates to the jury commission and jury duty, and apologies if you had already mentioned it, but that I think you all are encouraging potential jurors who are either in high-risk medical situations or elderly to seriously consider taking advantage of the opportunity to postpone their jury service as you allow through the courts, correct?
So in speaking with the jury commissioner, I am aware that those questions started coming in about a week ago. There is the ability to postpone that service for a 6-month period of time. Obviously, we're being very liberal with that policy at this point in time. If anyone's concerned about that and they express that they'd like to postpone their service, we are assuring that is completed. So
excellent. Just wanted to bring that point forward because it's one of the county services that has the ability to touch any person in the county, that you could be down in the jury commission office very quickly, and I just want to make sure that the public knows if you fall into one of those groups that the courts are, as Pat indicated, taking a very lenient policy on that right now. So
Thank you.
Thank you.
So nothing else to report. I'll continue to update the board from an operational perspective, what we're doing internally. And as always, if the board has any questions, please let me know.
Thank you, and we'll continue to get updates from our partners in public health and EMA to make sure that we're all up to speed. One other thing related to this, we do have a State of the County address scheduled for April 2nd. Modeling good behavior, I think we're going to cancel that, or at least postpone it to another day. While we think it's important to make sure people are aware of the work of the county on an annual basis, there's no urgency to the address, and so that the State of the County will be postponed until further notice. Thank you all for being here. I think it's really important information. I think we want to make sure the community is up to speed. Our next presentation is also very important. It is related to the census. It's also related to what we just talked about, because much like voting, we're encouraging people to vote early or to vote by mail. The census kind of falls into those categories too, and so Chandra Youngbloth is here, and as is Steve Johns, to talk about how we are moving forward to the census. You're going to give us some elements of time where people are going to get letters, they can respond via letter, online, and avoid having someone knock on the door. So please help us understand where we are with the census and what all those time frames are.
Thank you so much for having us today. It's been a pleasure working with the city on this project. Chandra's out of the office of the city manager, and they've just got a bunch of people working on this project. It's so important to show that county is growing, the city is growing, and this is really the main way to do it. So it is truly important. I know COVID-19 has kind of stolen our thunder a bit, but we're here, and we'll give you the update real quick. Chandra's going to kick us off, and I'll join in about halfway through.
Great.
Well, thank you again to Madam President and the other commissioners for welcoming us here to talk about the census. And yes, like you said, it is important, because what do we use to prepare for disasters or responses to crises like this, or near crises like this, is census data, so we know who's in our community, who's at risk, what age groups people fall in, where they live, et cetera, and how many hospital beds we have, how many, what resources do we have to respond. So it is timely also. Sorry. Just to go over what we'll talk about is what is the census, why is it important, and when can we take it. Just a note, the census actually opened up online today. It's not working. So the census actually opened up today, and while every household in America will be getting invitations to participate over the course of the next several weeks, anybody in this room, anybody watching, can go online or call the U.S. Census Bureau and take the census right now. It's very easy. It's about 10 questions. It's less than 10 minutes, and the website is https://my2020census.gov. It takes you right to the form.
Could you say that, make that easier?
Yes. My2020census.gov.
Yes.
Yeah, my2020census.gov will get you right there. Or you can call 844-330-2020. So both of those open today. They're ready to go. The federal government is there, ready to take your census for you, with you, and it should take less than 10 minutes. So what is the census? Every 10 years, basically, the federal government takes a head count of who is living or staying in America on April 1st. So while the census actually opens today, Census Day is considered April 1st. And what that is a reference point. So whether you take the census today or you take it in July, you're going to be counting how many people reside in your household as of April 1st. So if you're taking it today, think about who is laying their head on pillows in your home on April 1st. And this is important because the U.S. Census data allocates approximately $675 billion in federal funds to communities each year. That's about 300 and more federal programs that are funded through census. It determines the number of states the number of seats we have in Congress. As we all know, in 2010, Ohio lost 2 congressional seats. We redraw our federal and our local legislative boundaries based on census data, and we will be redrawing Hamilton County's jurisdictions for state House and state Senate after the census. We use census data for everyday decisions. So government looks at census data to inform them about all the decisions we make at the city or at the county, thinking through things like transportation needs. Businesses relocating into the area use census data to determine where they're going to go and what's a competitive area to go to. We use it for things like housing assistance. We use census data for things like federal Pell Grants and things like that. So there are many, many ways in which our everyday lives are impacted by census data or census funds. Well, we ask people to remember 3 things about the census. 1 is it is important, as we just talked about. 2, it is easy. We talked a little bit about how it's available online or by phone. And 3, that it's safe, that your data it's encrypted, it's protected, that census data is only used for statistical purposes, and your actual name and information that you input on your census form is held secret for 72 years under Title 13 of the federal code. And so, in fact, every census taker that comes around to enumerate you, or even city and county employees that provided addresses to the U.S. Census Bureau, had to sign waivers saying that they would not divulge that information under penalty of $250,000 or jail time. So they take that very seriously, and they will not share that data with any other government agency. They won't share it with any state organization that's giving you aid or benefits, and they will not share it with your landlord. So if maybe there's some more people in your apartment than on your lease, that's okay. They're not going to share that information. So make sure you count accurately who's in your household. And so like I said, it's easy. You can do it online, you can do it by phone, or you can do it by mail. And online and by phone is available in 13 languages. And it's also fully accessible. So the website is 508 compliant. It's compatible with screen readers. There's actually a Braille and an ASL video guide available to walk people with disabilities through how to fill it out. And then there are guides in 59 additional languages to assist people with filling out the English form of the census questionnaire. So a lot of people want to know what's on the census, right? And like I said, it's pretty easy. It's pretty generic information. They want to know your name, how many people are living or staying in your home on April 1st, whether you own or rent, your phone number. They will only use that to follow up if they have questions about what you've provided to the U.S. Census Bureau. Your name, sex, age, and date of birth, whether you are of Hispanic, Latino, or Spanish origin, and your race. Those 2 questions are used to enforce the Civil Rights Act and Voting Rights Act, and they've both been on there. Well, Hispanic, Latino, or Spanish origin has been on there since 1970, and race has been on there since the first census in 1790. And then whether a person lives or stays somewhere else. Think about if you're sharing custody of a child, or you've got a kid away at college, something like that. And then the relationship of each person that should say household, not family. So we want to be very clear that every person in the household gets counted on the census, and anybody can fill out the census for everybody in the household. But if you've got maybe like a lot of roommate situation, if everybody individually fills it out, that's okay. They're going to check the data on the back end. They've got, smarter people than I have written computer programs that can flesh that data out and make sure it gets taken appropriately. But we want to make sure that if you have multi-generational households, if you have roommates that are not related, or you have multiple families under one roof, that everybody gets counted.
So I'm going to run through real quick some of the importance of the census, particularly to Hamilton County. One thing is we are putting some money toward this effort. Some of our community development block grant funds are being used because of the importance of this, and so it's important to know that the county is doing its share to make sure that people are getting counted. When you look at these statistics, it's really almost mind-boggling that about 1 out of 4 Hamilton County residents were not counted last time around. And because each person not counted means we lose about $1,814 of federal money, it's really tricky. are really important that we make sure that we get this right. Chandra's fixed it for me. Very good. Very good. I told you were good at this. It's great to have a partner that can help me out. So you start to do the math, right? When we look at the city, and if they were in that same kind of boat of about only 3/4 of folks, even less in the city actually, being counted, and you start to multiply the population number, and then by that $1,800 per year that we lose, we're talking billions of federal dollars that are being lost. So we can't overstate that. $3.4 billion just because folks didn't take the 10 minutes to fill out the form. So we really need that help. And, we've kind of hammered this home. How does it impact? It's things that impact all of us. Housing, medical, roads, education, and particularly kind of the frustrating thing is it impacts services that help the people that need them most in our community. So that's why we're really trying to, again, hammer home that it's probably the folks that fit into this hard-to-count demographic that probably would benefit the most from actually filling out the form or doing it online. And so this year is really different in that we're not using very many messages that we spread across the entire county or the entire city. We're looking at those targeted areas that we know had been hard to count in past censuses. So the darker shades on this map of the county are the places with the higher non-response rates that are more of the hard-to-count population. And you can see that a good many of those are in the core of the city of Cincinnati, but they cover a lot of areas of Hamilton County as well. So these are the areas that we'd really want to call out and say, wow, extra effort is needed in places like Arlington Heights, Elmwood Place, Lincoln Heights, Laughlin, many of the areas in the so-called valley of Hamilton County. Also, surprisingly, it's along the 275 area. Springdale, Sharonville, Forest Park is another part of the county that has been historically undercounted. And then some scattering areas that I would say probably that north central area that you've heard about in other venues about the housing crisis in that north central part of the county. But between Colerain Avenue and about Hamilton Avenue, that area is also an area that we're going to target efforts to make sure we get people out there filling out the census. What does a hard-to-count population look like? These are some of the groups that often are in that group. Young children, sometimes they're not thought about. Even newborns a lot of times are people aren't thinking about that they should be counted. Racial and ethnic minorities. People that are, couch surfing, right? Which place are they located? Low-income persons, homeless people. Obviously, there's special efforts made for homeless populations. Undocumented immigrants who, of course, are perhaps scared about the census. So it's no surprise that these are the populations that make up the hard-to-count areas. I'd have to do a quick shout-out to places like Gulf Manor and Lincoln Heights, who have really put together some kind of novel ways to get people involved. I think Gulf Manor is actually looking at doing like a raffle where if people come and fill out the census at the government building, they'll actually be entered into a way to win a TV or something. So kind of a different way to do it, but there's all kinds of efforts like that that work best for individual communities. I think in Lincoln Heights, there's so many churches in Lincoln Heights that's one of the ways that they're looking at making sure they get the message out through those leaders. So I think we're in good shape. I think there's a couple more slides that Chandra's going to show.
Yeah, so we talked a little bit about when could you take it. The answer is right now, after this meeting. And we are asking everybody in the room and everybody watching to please try and take the census today or in the next few days. I know that there's a lot going on, but then definitely share that out amongst your networks and letting people know that you took it. It's really important. It was super easy, and that you encourage everybody else to do it as well. So here's sort of the timeline. The census is open today. Between today and about the 20th, everybody's going to be receiving official Census Bureau mail with detailed instructions on inviting their household to participate. It may even include their census ID number. There's an important distinction to make about that. The census ID number is tied to their address. You can take the census anywhere, anytime without that number. The only difference is if you have the number, the Census Bureau automatically will fill in your address for you on the form or over the phone. If you don't have the number, then you just go through extra steps of inputting your address. So you can totally take it without the census ID number that is mailed to your household. Reminder letters will come out between the 16th and the 24th. Then between March 26th and April 3rd, additional reminder postcards will come from the U.S. Census Bureau. Then, like I said before, Census Day is April 1st, and that is the reference point by which everybody enumerates their households. And then for those that have not responded by that point, between the 8th and the 26th, hard copies of the census will be mailed. I do want to make a caveat right here, though. The Census Bureau announced, I think about last week or so, that in some of the hardest to count communities, an actual hard copy census form could be coming in any of the previous mailers. They've identified areas where there might be low internet usage or internet access, or in some of our hardest to count communities. So if you do get a hard copy census form before April 8th to the 26th, just make sure it's coming from the U.S. Census Bureau, it's being mailed from their processing center, it's in Jeffersonville, Indiana, and that's legitimate and that you should be taking it when you get it. And then the final postcards come out at the end of April, and then for those who have still not filled out the census by then, beginning in May, the census takers will start knocking doors over the summer. So generally speaking, from May 1st to about July 31st, you'll see census takers in your neighborhood. And they will knock several times, attempting to make sure that the census data is collected for your household. So just remember, the census is safe, that your data is secured and will not be shared with any other law enforcement agencies. And to recap, it's really important because of the federal funding and the distribution of that funds, that we in our region want a fair and accurate count. We're growing, we're booming. I think we're booming faster than any other region in the state, certainly in the tri-state area. So we got bragging rights at stake too. And then we want to show that Greater Cincinnati counts and Hamilton County counts. So let's make sure that we call everybody to action. And then you can follow us on our social media and websites. So if you go to greatercincinnaticounts.com, we have a full resource page with handouts, all sorts of things that we have created or pulled from other entities, whether it be the U.S. Census Bureau or where we've made a local take on things like that. But there's all sorts of fact sheets, handouts, and great resources that you can pull from that site, including many things in foreign languages. So if you have an audience that speaks another language, you can get some resources there. And then by all means, please do amplify our message on social media. So I do want to take a point of privilege and say that it's been really great working with the county, between the city and county on this. We've got a great work group. We meet weekly. The planning and communications department at the county have been just super, and we could not accomplish this without this joint sort of committee working together. It's been great.
You. Yeah, it's been a great joint effort, as you said. I have one favor to ask. Could you please provide that presentation to us in hard copy, because I know all three of us are out in the community all the time and doing presentations about the census, and what a great presentation. So thank you for doing that, and if you could get it to us. We're all hard copy people, I think, so.
We absolutely will, and I have since updated it with a slide with the live phone number and website in it too.
Okay, great. Thank you very much. Any questions or comments?
Just a comment. Thank you, Madam President. Thank you for your presentation. And Steve, I know when we had talked about City of Forest Park being a non-response area, specifically called Forest Park, and come to find out there is a rectangular area in Forest Park that does not respond. So I have that area, those specific areas, so maybe we can focus directly on that. So I just wanted to...
That is totally part of the strategy is folks that trust people to get out into areas and have it be specifically targeted to those places that we know need a little help.
Great. Thank you.
No questions. Thank you very much.
Okay.
Well, let me ask you, do you have enough census workers to knock on doors?
Well, that's a good question. So the federal government is still hiring census workers to enumerators that will go out door to door. They'll be continuing to hire through, I think, mid to late March. The door knocking, as I said, starts May 1st, but they do training before then. So as of about a week ago, they were still looking for people in the Sharonville area, up near Tri-County, and then mostly in that, like, Cuff, Clifton, area and Mount Auburn and over the Rhine, and those all sort of track out to hard-to-count communities too, and they like to send enumerators from the neighborhood to knock on doors in their own neighborhood. So it's sort of a double whammy. They definitely need help with that because not only are those hard-to-count communities, they're struggling to get enough enumerators to go door to door. And then if you think about specifically around Cuff in that area, you know, another hard to count demographic are people who live off campus but are age 18 to 24. And we got a very short window to capture them before they leave for the summer for their internships or go back to their permanent residences or things like that. So.
And did you give us the information on how someone can apply to be an enumerator?
You go to 2020census.gov/jobs.
There we go.
And the hourly rate wage is quite good.
23 to 26 dollars an hour, we understand. Yeah. All right, great. Thank you so much. Thank you for the update. All right, we'll move on to public comments. I have one speaker's card. It's Dr. Vlastomolik. You've got the pleasure of the floor for 2 minutes.
My maternal grandpa and grandma were in the census 1920 of Pittsburgh, but the family moved back to the old country, so I had to wait a year to get my visa in 1975. Now, I was glad that many people showed up for this coronavirus thing, because as a risk assessor from that worked in the federal government in EPA, on viruses and bacteria, my estimate is that the risk to me, although I'm in the high-risk category, is low enough that it's worth coming to speak to you, and apparently other people here too. That too shall pass. In 1918, there was a flu that killed over 20 million people, which was more than the World War I, and it went away just like chicken flu and swine flu and all those other things. So one shouldn't be too hyper-sensitive to that kind of stuff and just take common sense measures. What I came to talk about is here, that if a Martian came here and looked at you guys, they would think that 100% of this county are Democrats, 100% are women, and 67% are black women. Now, talking about diversity and inclusion, and we have a coordinator for diversity. Where is diversity here? Where are white men or black men here, except that 3 guys, both Republican and Democrats, are persuading us, trying to persuade us that we should vote for increase of our taxes. When I came to this county in 81, the sales tax was about 4%. Now we are up to 7%. When are we going to vote to decrease our sales taxes and our real estate taxes and decrease the importance of government and become self-sufficient as we are granted by U.S. Constitution?
Thank you. We have a public hearing on our agenda, and so if you, with your deference, I'm going to take that up next. So we have a public hearing to consider the issuance of County of Allen, Ohio Hospital Facilities Revenue Bond Series 2020. So who is going to?
I think Michael Dean is here for.
Oh, very good.
Kick this off for us.
I'm here. I want to start. I'll just kind of explain what this usually works like, and we'll go from there.
Okay.
My name is Michael Dean. I'm from Dinsmore and Scholl. We're a law firm downtown Cincinnati. We have our colleagues up in Columbus that are working with Mercy Health, or Bon Secours Mercy Health, the new merged entity, on a new financing of new projects and refinancing all throughout the state. I'm not sure how many counties they're financing in this year, but it was, I think, 17 counties when we did this back in 2017. So this similar public hearing has already been held in let's see, Brown County and Warren County. We're holding one in Butler next week, and then Claremont is yet to be scheduled. But this is a big sort of operation on our end to get all of these hearings held. The reason for the hearing is federal tax laws require that when we issue tax-exempt private activity bonds, so bonds for private users like Mercy Health, that requires the public to be noticed and for an opportunity to be heard, not only in the jurisdictions that are issuing the bonds, but every jurisdiction where those bond proceeds will be used. So even though Allen County, in this case, is issuing all of the bonds, some of those proceeds will be used here in Hamilton County and the other counties that I mentioned. And so because of that, we need the approval of the highest applicable elected representative. Collectively, that is you as the Board of Commissioners. And so the approval we're seeking is not to issue bonds, but simply to approve the issuance of bonds by Allen County. So I'm here to answer any questions on this financing. In terms of numbers, I think they're looking at a max of $250 million of a $525 million bond issue would be spent here in the county. So I'm here to answer any questions. And of course, open and hold this public hearing. If anyone's here to speak on the issue, they should have time to be heard.
Yeah, I don't have any speakers cards related to this issue. Is there anyone here to speak to the issue? Okay, seeing none. Are there any questions or comments from the commission?
Madam President, did we get additional information on this, or did I miss it? Has there been any additional information given to us in writing?
It would have been in the agenda packet, I believe, yes.
And where is it?
Yeah, just in Hamilton.
Legislation on item 1.
Item number 1.
And your notice of public hearing that is attached to your public hearing has that list as well.
Okay.
It's enumerated, it looks like it's on page 2 of the public hearing information that I
Okay.
which is in the notice of public hearing. And then the Dinsmore legislation.
I have that, okay.
That
Okay.
details it as well.
Sure.
Is there also an additional hearing, or is this the only one?
This will be the
another
only one in Hamilton
The
County,
only one.
correct? Yeah, I think there's 88 facilities that they will be refinancing or putting new improvements into throughout the county. So hundreds across the state.
Okay.
It's through completely. I didn't read it all the way through, so,
Okay.
yeah. Is there a timeline on this?
They are seeking adoption of the resolution today. We could certainly take some time on that. They're looking for the 19th to have all of these hearings held and completed and all the approvals obtained from the various counties. So obviously that, next week would be the 19th. I could certainly be happy to come back up at that point.
Yeah, Madam President, I'd like to read this thoroughly, if I could.
Okay. Are there any comments or questions from you, Commissioner Parks?
I have none.
Okay. I know we had the information in advance, but I respect that you have not had a chance to go through it. So how about, I don't want to necessarily delay it until the day it's due, so why don't we take this up on the 17th? We can't on the 17th. All right, well, we're going to then do it on the 19th.
It's not a hard date, it's a goal
We're not
for us.
putting any money toward it. They're going to actually give us money through it.
Right, so I just was hoping not to bump right up against the deadline.
Well, in the county, I should be clear, the county won't receive any funds from this.
Yeah.
If they issued the bonds through the hospital commission, which we would typically do when you see me here, then there's a fee paid to the hospital commission. But in this case, there is no separate fee for a type of approval that would be typical.
Yeah, and that's what I was just saying to the president, mumbling that we don't have to pay a fee or anything, so.
Correct. So 19th.
I'm good with it.
Okay, you're right, all right.
So the good news is we've completed the first requirement of holding the public hearing. So next we would just, presumably
with it.
could be on the consent agenda if there are no other questions.
We're going to, first of all, I'm going to move that we close the public hearing.
Sure.
Second.
Yes.
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 Thank you. Okay, we've got a level of comfort here, I think, amongst us. So knowing that, I am going to move that we approve of item number 1 on our regular agenda.
Second.
Yes.
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 Thank you. Thank you for being here.
Thank you, commissioners, and Jackie, as always, thank you.
All right, we're going to move back up into comments and motions of commissioners Commissioner Summer Dumas.
Thank you, Madam President. Just a few things. First of all, I wanted to thank you for bringing all the key players in here to for the county and the residents and staff to listen to their important information. So in addition, I just wanted to make a few comments. I attended the elected officials and sponsors reception at the Cincinnati Symphony Orchestra, and I want to thank them for their invite, and it was a great opportunity to share what we have here in the county. And in addition, I attended the Imagination Library press conference at Children's Hospital. We had them come in a few weeks ago to talk about Governor DeWine's, Fran DeWine, and her effort as it relates to putting books in the homes of young people. So we're waiting. I did let them know we're waiting to hear something back from them as it relates to financial impact that the county may have in this important project. And lastly, I met with Holly and Joy Pearson as it relates to the Community Development Block Grant and the eviction assistance program that they have. And I'm sure they'll be talking more about it. It'll be coming in front of us to look at whether or not we can undergird the cost of that eviction assistance program, which is very important. So I also had the White House briefing call yesterday, which I think all of us were a part of. It was very comprehensive as it relates to the virus and what the White House is trying to do and implement and what their expectations are for us. So that's all I have, Madam President.
Thank you. Commissioner Parks?
No comments. Thank you.
All right, I'm just looking at my calendar. So I do want to note, and I know the notice has gone out, that we will not have our regularly scheduled staff meeting next Tuesday because it's Election Day. It does free us all up to be employees at the Board of Elections. So I just want to say in our staff. I've actually done that in the past. I've been a poll worker. Have you? Inside poll worker. It's a long day. But it's an important service, I think, and we do, yeah, it is, and we want to encourage people to help out when it comes to being an inside poll worker. I can understand how some individuals who are particularly older, especially over the age of 80, might not want to come into contact with that many people on election day. So do want to, again, encourage folks to step up and do that. And so we will not be having our regularly scheduled meeting on Tuesday, just as a note. I have one by-leave item that is in your packet. It's related to the UMCI. We have talked many times about the UMCI, and this is a resolution that we have contemplated in the past. There have been some revisions made by both MSD and county staff related to this item, and so I'm going to put this in a nutshell, and you all can correct me if I'm not correct, but what we are trying to accomplish here is twofold. One is to respond to the immediate need in Green Township related to this pipe, and then one is to respond to the more long-term need of having something in place, a new pipe that does not cause any additional overflows downstream. And so this resolution, and we were poised to take this up last week, and we hesitated just because we had some language corrections. So now we are ready to pass it. My understanding is that there's common agreement between the city and the county related to this resolution. I have also reached out to Greg Landsman, who is the council member dealing with this in his committee, to let him know that we're doing it. I will get him the final language after we pass it to make sure that we're all on the same page and everybody's up to speed as to what we're doing here. So, Holly, did I state that correctly? Diana, did I state that correctly? All right. So, are there questions or comments related to this resolution?
Thank you, Madam President. I'm just glad that we're at the point that we can pass this resolution today.
Ditto.
All right, okay, wow. Well, then I'm going to further expound just a little bit and say, so what is expected then is in the short term, some patching of the very egregious holes that are in the pipe from which sewage is leaking. So that's the temporary fix, knowing that the long-term fix is the replacement of that pipe. We just got some information from the city last night about the impact to downstream. And so we're very concerned about that. So we have to sort through that. I have not had a chance to look through that as we just got it. But we will do that very quickly, I hope, and come to a long-term long-term solution here, hopefully within the next couple weeks. But in the meantime, we want to address what's happening right now. So that's where we are. So I'm going to move that we approve of the resolution redirecting MSD to prepare detailed plan, specification, estimate of cost, and other relevant documents for sanitary sewer number 6716, project ID 101300042, UMCI replacement phase B, consistent with board policy and direction.
Second.
Yes.
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 Thank you. Thank you all for being here. All right. Administrator Aludo?
No by-leave items. Commissioners, just one follow-up comment back to the COVID-19 planning, but really just more from an operational perspective. As I alluded to, Board of County Commissioner Departments will be testing and exercising our continuity of operations plan, specifically our remote workforce and telecommunication plan over the next week or so. We're not doing it all on one day. We're doing it on a rolling basis with departments under the board. And I don't expect any glitches in operations, but we're testing it strategically and having department heads pick and choose the portions of their operation that they want to exercise that policy and those plans with. But I just wanted to let the board know that that was going on just from an operational perspective. Again, I don't expect any complications, but just so you're aware, that'll happen between now and the end of next week.
Yep. Thank you for doing that.
You're welcome.
Jeff, thank you for doing that. All right. We have a couple other regular agenda items related to the engineer. Eric, back. This is how it goes, you know. Ted used to sit through all of this stuff. We've got issues, or items 2, 3, 4, and 5 related to the engineer.
Thank you. Item 2 is just setting the date for a hearing on a vacation request of public right-of-way easement on Remington Road. Standard item. I believe Bob Heikamp's here if you have any questions on that issue. Item number 3 is the resolution to vacate Simonson Road, which we had the hearing on last week. That's to close that out. Item 4 is a resolution for Western Hills Viaduct, placing a load limit on that. The City of Cincinnati, late in 2019, did a in-depth inspection on the bridge. That, along with some changes to state and federal load limiting requirements, now will require load limit being placed on that by the City of Cincinnati for trucks that have 3 or more axles. And that'll affect about 5% of the vehicles that cross that bridge. And then number 5 is just authorizing the advertisement and bid for the sidewalk replacement projects that the board has already heard.
Thank you. So related to item number 4, as I read through this, I guess my question, first of all, it illuminates the need to get going on the Western Hills Viaduct. Well, the local match is in place, the city has stepped up, the county has stepped up. Gosh, we did it years ago, a couple years ago. We've got the local match in place. We do need our federal partners to come through here. We've been applying over and over again for federal funding for help with the viaduct. It is an expensive project. It's somewhat complicated because it's over a rail yard. However, it is in dire need of repair. And so when you see an item like this on the agenda, it just reinforces the need to move forward here. So I wonder if we don't want to send this resolution up to the federal delegation to make sure that they are aware that this is partly, because we don't have a new bridge or a new viaduct, right? So, and I'm jumping to a conclusion that I think is true. You tell me. If we were to have a new facility here, would we still have the load limits that?
No.
Okay.
The new structure would remove any load limits.
So here we are limiting loads because we don't have a new viaduct. It's just very, very frustrating to have to pass a resolution like this. I understand the need for it. I'm sure there are safety impacts here. And I know you've given us a chart of how many vehicles are impacted, and we have to have the signage up pretty quickly. But let's send this up to the federal delegation to say, because of the delay in the partnership funding that we are all waiting for, we have to do certain things like this to constrict some of the commerce that would otherwise be flowing across the viaduct.
Absolutely. We have a federal grant application that will be going in May, and it will include that in that as well.
Okay. And I know we continue to apply for every funding source that
We just
is
applied for an
available.
infra grant that in the last 2 weeks that was applied for. We have some other federal grants coming up. We continue to apply for everything we have the opportunity
All right.
to get any money on.
All right, very good. Any questions or comments related to these items?
Sure, Madam President.
Yes.
Item 4 also, I had just a couple comments. I noticed in the memo it says most vehicles can cross, so that's a little scary. The viaduct is still safe for most vehicles to cross, so we know it's an impending item that we need to take care of.
That's correct.
But at the end, I kind of highlighted, you said that there will be signage up to let everybody know about the entry points. Is there going to be any other stricter enforcement of these trucks coming in and other than
I'll have to
the
defer
signage?
that to the city of Cincinnati since the city will be enforcing it since it's inside their jurisdiction.
Okay.
I
Okay,
will
we'll find
talk
out,
to the
yeah.
city and find that out.
That
Yes.
would be great. But this was good, the depiction of how it's going to be. So thank you. I
You're welcome.
appreciate it. Mhm.
Thank you. All right, I'm going to move then that we approve of regular agenda items 2 through 5.
Second,
Yes,
yes.
Yes.
thank you.
Thank you.
All right, we're going to move into the consent agenda items, 6 through 20. Are there any questions or comments related to these items?
No questions or comments, Madam President.
No questions, no comments.
All right, I'm going to move then that we approve of consent agenda items 6 through 20.
Second,
Yes?
yes.
Yes.
And then lastly, we have a travel agenda item, number 21, requesting authorization to travel at county's expense. Coroner employee to Philadelphia, PA, and coroner to San Diego. Jeff?
Yeah, I was going to say the same
I'm
thing.
scratching my head right now, wondering if these are employees traveling to large conferences or something else.
I cannot answer that question right now. We can, obviously, these were slotted into the agenda queue well in advance of the item that is on us fairly quickly in terms of the coronavirus. I can find out on that fairly quickly, though.
Can we hold this for a week?
I am not aware of any timing urgency on this. Jackie, do you know?
Tax, yeah.
Okay.
Yeah, we're looking, it's October. Yeah, so we're fine.
By which time we might be fine. But
Yeah, exactly.
let's not do this right now. Doesn't seem to make sense. So I'm going to move that we approve of, we already did the consent agenda items. I'm going to move that we hold travel item 21 until a date further.
Second,
Yes.
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 Okay, thank you. We have nothing further in front of us. Anything else?
I have nothing.
Nothing.
All right, very good. I'm going to move that we adjourn.
Second,
Yes.
yes.
Yes.